Hi, you're probably getting ready to have surgery soon. You've picked out your surgeon, you know the surgery you're going to have, you've probably Googled it, you've talked to your insurance company, you're ready to go. But hold up, let me tell you something. I've been giving anesthetics to people, young and old, and everyone in between, for every kind of anesthetic imaginable in almost any type of situation. And I can tell you, there's one thing you might not have thought about yet, and that is, what is your anxiety level? Of course, you're anxious about having anesthesia and surgery. Everyone is. It is a completely normal human reaction. I mean, really, you're facing something that is completely out of your control and really quite scary. You might be concerned that, will I wake up? How will I wake up? Will I be different? Will I have permanent injury? All of these things are a real things that people think about, that people go through. I can tell you that anesthesia is really safe. We know that about 1 in 10,000 people experience some type of serious reaction, and that number is less in children. It might be about 1 in 50,000. But to put that in perspective, driving in your car on the way to the hospital or the clinic or on the way home is much more dangerous than having your anesthetic. However, of course, you're going to be nervous about it. It's weird. Everyone honestly thinks that they are going to die. That is just the reality of anesthesia with surgery. So try to think about those numbers. Hopefully that gives you a little bit of relief. But regardless, most of us today, if you're living in today's world, have some level of anxiety. It is completely normal. We don't know what's happening day to day, financially, culturally, socially. There's so many changes that we're going through, and it really does cause a lot of anxiety. We don't have the community we used to. It's just a more difficult place to live in. So anxiety really is a daily part of our life. And luckily, there's a lot of things that we can do that a lot of us are doing to manage that, getting the help that we need. Let me tell you something else. We know, and I know, that when someone has anxiety before their anesthetic and it's not managed well, we know that you will need more anesthesia to go to sleep, more anesthesia to stay to sleep. And we know anesthesia has side effects. Nausea, blood pressure issues, heart rate issues, problems with memory, all of those things, right? And if you're more anxious before you go to sleep, you're going to need more of that anesthesia, again, with more of those side effects. So that's what it shows in the literature. That's what we've been seeing over the last few years in the data, in the science. We are seeing that. And of course, I can tell you, I have seen that for 20 years over my career. The more together someone is before they have their anesthetic, the easier it is for them to go out. And what I mean by that is, if I bring someone back to my operating room and they're on the table, I spend that time trying to get them really into their body, embodied, so that they can, from that point, go out with the anesthetic. If you have someone who has a high amount of anxiety and they come into the operating room, their body is there on the table, but their mind and their energy is all around the room, and that all has to come in before it goes back out. So you can imagine the kind of discoordination, physiologically, mentally, emotionally, spiritually, all of those things, if you have to go through that process of coming in before you go back out. Again, that's why more anesthetic is going to be needed with someone who has baseline anxiety that's not managed well. Let me tell you something else. So that is the amount of anesthesia you're going to need to fall asleep and to stay asleep. But there's other things that anxiety affects. The first one is how much pain you will feel afterwards, the perception of pain. So if you have more anxiety before your surgery, chances are you're going to need more pain medicine after surgery for those same reasons. So again, more pain medicine, more side effects of the pain medicine. We know, dizziness, constipation, anything, itchiness, all the things that come with having to need more pain medicine. The other thing that high anxiety that's not controlled will lead to is more nausea, more stomach upset, more vomiting. All of those things can be related to the amount of anxiety you have before your anesthetic. The other thing is, when your anxiety is high, it takes longer to recover, and there's a higher chance of infection of the surgical area just from having anxiety. And the last thing is, we all want to get back to the life that we were living before we needed this surgery. And if our anxiety is controlled, we can get on that road to recovery the moment we open our eyes, start healing, and get back to those things that we love. So I really am really excited to share with you this program that I created to deal with just that. Over the 20 years I've been giving anesthetic, I have worked with so many people on how can we help them have the best experience they can. So this is a 3-part module, and I will go into it in the next video. But basically, it's the very first part is restore. We're going to restore our patterns of living. That relates to things like finances and the day-to-day activities. We want to set it and forget it so that that takes a mental load off of anything that we might have to be thinking about during our time of surgery. The middle part of the program is reset. So we are going to reset your nervous system. Things like breath work, meditation, guided imagery. We're even going to take a look at diet and sleep and even the light that you are exposed to throughout the day. We are going to teach your body what is asleep. We're going to teach your body what is awake so that you can have a better transition with your anesthetic. The last thing we're going to talk about is the recover stage, and that's just the week before your surgery. What we want to do is set you up so that you have everything you need so that you can recover well. Like I said, you can hit the ground running as soon as you get home. We're going to work on setting up a healing environment so that you have what you need and nothing that you don't. We don't want to be reminded of our day-to-day things when we're in a place of healing. And anyone that has surgery, no matter how big or how small it is a big deal. We face things in ourselves. We face, frustration, and we want to get and do things faster, and all of these things. It's a big hero's journey. We are facing, possible injury, possible anything that could happen with anesthesia and surgery. So it's a big life-changing thing. So in that last week of recovery, we want to set you up so that when you are going through your recovery, after you get back from your surgery, you have all the tools that you need to take advantage of this opportunity for self-reflection. We have a checklist on how is your wound healing? Are you eating enough food? Are you eating the right foods? How are you managing your pain? What medicines are you taking? What other side effects are you experiencing so that you and your doctor can have a better communication about what is going on with you in your recovery so that you can get better care. So all of these things are designed so that you can have a better surgical and anesthetic experience. I know that you can do all this. If you have a few weeks before your surgery and you can breathe and you have an imagination and you have the desire to, get things in order, I know that we can have you have a better experience. So please click the link below, and I am so excited to be working with you. Happy healing.